So imagine a society where criminals can put police to sleep. Now imagine this inside your body. So effectively, cancer can be the criminal and the immune system can be the police. And cancer can put the immune system to sleep. This is called T-cell anergy. So today we're going to be talking about Keytruda, which is a way that you can wake up the immune system.
Upon diagnosis with melanoma, Jimmy Carter said, "When I found out it was in 5 places in my brain, I just thought I had a few weeks."
So what's the problem? Well, there's not just one problem. There are multiple types of cancer that pembrolizumab can treat. One is melanoma, and the other is non-small cell lung cancer. So melanoma is a type of skin cancer that causes almost 74,000 new diagnoses per year in the United States alone, along with nearly 10,000 related deaths. Lung cancer is a huge problem. It causes over a quarter of the cancer-related deaths, as well as non-small cell lung cancer being 85 to 90% of all lung cancers, which causes approximately 220,000 new diagnoses per year in the United States, as well as nearly 160,000 related deaths.
So there are some current treatments for both melanoma and non-small cell lung cancer, such as surgery, radiation, chemotherapy, and targeted therapy. And now there's also immunotherapy. So this one is an immunotherapy, and this is chemotherapy. And as we can see, data seems to show that pembrolizumab, or the immunotherapy, is more effective at treating cancer than chemotherapy. Also, surgery, radiation, and chemotherapy have some problems. Surgery and radiation may not always attack metastasized cancer cells, while radiation and chemotherapy might affect cells that are not cancerous, and that could be harmful to the body.
So, why are immunotherapies important? So, an important thing about immunotherapies is that they target the immune system, not cancer. So what you need to know about the immune system is that the immune system fights off diseases in the body, and an important aspect of the immune system that we will be focusing on today is the T cell, which is a type of cell in the immune system.
So before understanding how pembrolizumab works, we have to understand how cancer cells and T cells interact. Cancer cells release a ligand called programmed death ligand 1 and programmed death ligand 2, and these bind to the programmed death receptors on T cells. These receptors associate with SHP2, which is a phosphatase, so it dephosphorylates ZAP70. ZAP70 allows for transcription of the transcription factors AP1, NFAT, and NF-kappa beta, which all allow for T cell growth, survival, and cytokine production. Okay, so can anyone here explain to me how binding of PD-L1 or PD-L2 affects T cell activity?
Repeat that again?
It's on your sheet.
The activation of PD-L1 inhibits ZAP70 and so in turn inhibits T cell growth.
That's not right. So the cancer cells are effectively stopping T cell function.
So where does Keytruda come into all of this? So when a cancer cell and a T cell interact, there are multiple sites of binding. One of them is the major histocompatibility complex and an antigen and the TCR. So this is the cancer cell and this is the T cell. And here's one of the sites of binding. This allows the T cell to recognize exactly what it's binding to, in this case, the cancer cell. And as we previously discussed, there's another site of binding, which is PD-L1 or PD-L2 to the PD-1 receptor on the T cell. So Keytruda binds to the PD-1 receptor as an antagonist, so it does not activate this pathway. Instead, it blocks it. So when a cancer cell and a T cell interact, the MHC antigen and T cell receptor all come into contact, yet PD-L1 or PD-L2 cannot bind to the PD-1 receptor, thus the cancer cell cannot inhibit the T cell function, which is to kill the cancer cell. So how do we know this works? As you can see on the graph on the left, there was a study done with patients with melanoma. The triangles indicate the group that did not respond to the treatment of pembrolizumab, meaning that their tumor size increased, while the circles are the response group, or the group that did respond to the treatment and had a tumor decrease. So CD8 positive cell density refers to, CD8 is a receptor on the T cell, but in this case it is identifying the type of T cell that would have the receptor. So the more CD8 plus cell density, the more likely that that the patients would respond to the treatment, because as you can see, in the group that did not respond to the treatment, there was little to no CD8 positive cell densities. In addition, if you look on the right, there is staining in a tumor of CD8, PD-1, and PD-L1. So this is all one tumor, and this is another tumor, pre-treatment. And this is the group that did respond, and this was the group that did not respond to treatment. So as you can see, CD8, PD-1, and PD-L1, which are all stained brown, are much more prevalent in the tumor that did respond to treatment than the one that did not. And so this shows that that the more CD8, PD-1, and PD-L1 in the tumor, the more easily pembrolizumab will work in treating the cancer. Does anyone have any questions on treatment?
Could you just go over quickly exactly what PD-1 and PD-2 are?
PD-L1 and PD.
So PD-L1 and PD-L2 are ligands expressed by the cancer cell that bind to the receptor on the T cell and shut the T cell down.
When you say that on graph on the left, the triangles are those babies that
These are the ones that did not.
That did not respond to the treatment. Does that mean that they didn't get the treatment?
They did get the treatment, but it was not effective.
So
they both had melanoma, except as you can, like for example, this one there's more CD8, PD-1, PD-L1, and same with this one, and the one with less of CD8, PD-1, and PD-L1 did not respond.
If you said that PD-L1 inhibits the production of T cells, why would there be more of it in the response group?
This is
so you need this is before the treatment occurs, because you need more of all of these factors for the drug to take effect. Yes. We're going to move on.
So there has been clinical evidence as well for the way that pembrolizumab works in melanoma, and overall survival plateaued at about 55 to 65%. And pembrolizumab was administered in 2 milligrams and 10 milligrams per kilogram of body weight, and both of these yielded about the same survival rates. So that has given rise to the 2 milligram dosage.
For non-small cell lung cancer, there was these are all patients with non-small cell lung cancer, but the PS percentage refers to the amount of PD-L1 expression in each tumor. So as you can see, when the percentage of PD-L1 expressed is greater than 50, the overall survival plateaus between 60 and 70%. So this shows that so when the tumor has more than 50% of PD-L1 expression, it is the most effective when treated by pembrolizumab.
So why does any of this matter? Pembrolizumab has been approved for both melanoma and non-small cell lung cancer, as we discussed, but it is also in different phases of testing for a variety of other cancers, because rather than targeting the specified cancer cell, it targets the immune system.
So recently, Jimmy Carter, who was found to have had melanoma in 4 spots on his brain because of metastasized, was treated with radiation and Keytruda. And just this week, he announced that he had no signs of cancer. So he said, my most recent MRI brain scan did not reveal any signs of the original cancer spots, nor any movement.
Thank you.
So, do you have any questions?
Well, I know when we go through Hallmark, we learned that the immune system can actually have an adverse effect on cancer tumors. So, is there any way that this could actually promote tumor proliferation and growth?
So, the immune system is very complex, and so there are not just T cells in the immune system. There's also B cells. There's the innate immune system, and there's the adaptive immune system. So this is just one part of the immune system, and so they found that if they can, what is so-called taking the brakes off the immune system, then that will cause the T cells to just be able to work and kill the cancer cells. But actually, this does have negative effects because if you completely, if you think about it, if you take brakes off a car, then the car can't stop. So this does have negative effects on the immune system, but for this certain receptor on T cells, it doesn't promote cancer.
I remember from the reading assignment, one of the journals said that this therapy is like novel, like it's a really new treatment. What's like novel? What's new about it? What's so progressive?
I think it's the fact that it's an immunotherapy, so it targets the immune system. Targeted therapy targets cancer cells. Chemo also works on killing cancer cells, but this just helps the body to be able to fight the cancer that's already.
But it does not do it by itself. So a lot of times cancer can be treated with a combination of different therapies, such as the example of Jimmy Carter, because he was not just treated with Keytruda. So it is the newest therapy, and also it is actually newer than a different type of immunotherapy, Melanoma, which is it's the same idea, but just on a different. It just inhibits a different part receptor on the T cell, and it's also a frontline therapy for melanoma, but it's also being tested for many different types of cancer.
So because Keytruda is an immunotherapy, are the side effects generally not as bad as those of, say, like chemotherapy?
And side effects, some of them are similar, but some of them are really different. So chemo.
So basically, when you think about chemo, it just kills all of these cells that are rapidly growing. So that's why your hair falls out. That's why your nails stop growing, and your stomach lining stops growing. So there's it attacks healthy tissue cells that just happen to be growing quickly. So this has negative effects, but I think the most prevalent negative effect, besides toxicity, because toxicity is a problem, because it's just a foreign, it's like just foreign molecules being in your body, so that it can have toxicity problems. But the most concerning one would be autoimmune problems, or what I was saying, if you can't stop the immune system, so then the immune system would start attacking the body. So it would have different negative effects, but not the same ones